Hi everybody, this is Abby, also known as Scrappin' Abby, and today is March 2nd, 2016, and it marks my 1 year anniversary for having brain surgery and surviving brain surgery. For those of you who are here to watch any of my crafty channels, this particular video is going to be solely about my 1 year anniversary of going through and surviving brain surgery for trigeminal neuralgia. So if you're not interested in hearing about this part of my life or my journey, you can go ahead and click out of this video and go ahead and go on to any of my other crafting videos. But if you're interested, I would love to have you guys stay and listen in if you like, because this has affected my crafting, so it is kind of related. Also, a quick disclaimer, I have my little mini Dotson Bella. She's kind of roaming around. I took away all of her squeaky toys, but you might hear some noise in the background. It's just her. So, and I'm filming in my downstairs living room. Hope the lighting's okay. And here we go. So I also have my timer set on my phone because I want to make sure that I'm not talking too long and making this video too long. So pardon me as I'm getting this set real quick here. I thought I had it ready. And here we go. Okay, so again, my name is Abby, and I was diagnosed with trigeminal neuralgia in, I think it was officially diagnosed in October of 2014. I do have a video on my YouTube channel where it talks about my journey up to, I think it was in January of 2014 or excuse me, 2015 is when I posted that video. So I won't repeat all that just to keep this video from being too super long. But if you want to go back and look on my channel for anything brain surgery, trigeminal neuralgia, I do have a playlist, so they're separated, and you guys can go ahead and take a look at those. I also recently posted a 14-week post-brain surgery video just about a month ago, but I filmed it back in June, and so you guys can kind of look at that as well. So this is officially my 1 year anniversary from having brain surgery. So just to kind of recap, I was diagnosed with trigeminal neuralgia in, I think, like October 2014. I had brain surgery on March 2nd of 2015, and then approximately 4 weeks post-op, I was diagnosed with anesthesia dolorosa, and I go into great detail on that in my 14-week post-op brain surgery story. So if you guys want to kind of watch that video, you can go ahead and get the whole entire story. But basically what that is it's a extremely rare facial pain on top of having trigeminal neuralgia, and the only way you get it is when you have the brain surgery that I had to help alleviate some of the pain from having trigeminal neuralgia. My neurosurgeon up at OHSU, I live in Oregon, that stands for Oregon Health Sciences University, he told me, he saw me at my 4-week post-op. I actually went in on an unscheduled appointment due to a lot of additional pain and things that I was having in my face, aside from the trigeminal pain and the normal pain you have after having brain surgery. And he said that this is typically something he only sees in patients that are in the 50 to 60 age range, and he said even then it's very rare. I just turned 43 last November, so at the time I was 42, and he was just really perplexed. He just didn't understand, how I could have this. And what happened is my body regretfully took the brain surgery as an attack instead of a form of some kind of a help. So he just told me that my body is wired differently, unfortunately, and so that's what the anesthesia dolorosa is. I will also put a link in the description, and I will also put a link to all the trigeminal neuralgia videos in the description as well. That way it's easier for you guys to find. But if I forget, because my mind is kind of scattery sometimes, it is going to be on my YouTube channel, my playlist. So please forgive me if it seems like I'm jumping around, or if this isn't like, this isn't scripted. I'm just kind of letting it flow as it kind of comes out. Part of having brain surgery, or a result of having the brain surgery, the neurolysis, which is where he combed or frayed the nerve to damage the trigeminal nerve, which then in turn, oh, just a second, my dog is about ready to pull my camera off. Just one sec, guys. So sorry. Here you go. No, there you go. Here you go. Here you go. Come here. Lay down. Here you go. All right, so sorry about that, you guys. I have my camcorder charging, and my little dog, she got her blanket caught and she almost pulled it off the stand, so sorry about that. Anyway, what was I saying? See, that's what I'm talking about. Oh, part of the side effects of having the brain surgery. My trigeminal neuralgia, so sorry you guys, but I'm trying to derail. I don't want this to be scripted or edited too heavily. My trigeminal neuralgia is on my left side. So the entire left side of my face and my scalp is what is in pain and affects me, my ear and everything. So as I mentioned in my 14-week post-op video, I have numbness. I kid you not, it's just straight down the middle of my face. Like if you just drew a line, this half over is numb. And it feels like that sensation when you go to the dentist and you're about maybe a couple hours after you've had some Novocaine, that level of numbness you have where it's still kind of tingly. You can bite on the inside of your cheek, but you don't feel anything. That's what I have, and that's what I will have for life. And that's a trade-off you accept when you have that surgery, because it gets rid of the trigeminal neuralgia pain. But unfortunately for me, I still have the trigeminal neuralgia pain on top of having facial numbness and on top of having anesthesia dolorosa, which is basically, in layman's terms, painful. It's pain. It's painful numbness. I think is how Dr. Birchall explained it to me in a nutshell. So I'm really battling 3 different types of issues now with my face. But to me, it was totally worth the risk, even though I have now anesthesia dolorosa on top of trigeminal neuralgia, because when you have this pain, you will do anything to get out of this pain. I mean, anything. So I was willing and ready to accept those risks. So I've had a lot of people ask me, would you do the surgery again, knowing what you know now? And I still say yes, which might be perplexing to a lot of people. But for me, it's yes, because of the fact that I wanted to do anything to get out of this pain, because it was completely debilitating. It completely altered my life, affected obviously me, my husband, my kids, my coworkers, my job. Every aspect in your life is affected by having trigeminal neuralgia. So I was desperate to get out of this pain. I tried every medication under the sun. That's in my prior TN videos, so you guys can kind of look back and watch that information. So if you see me kind of stuttering, or if it seems like I can't articulate properly or anything like that, please forgive me. It's just the way that I am now, and I'm trying to, even a year post-op, still trying to get adjusted to my face being numb. It's just such a weird sensation. It's like if I drink like hot coffee or anything, eat something spicy, I don't feel anything on the inside of my mouth. The right side is completely normal. I can totally touch my face, not a problem. You touch my face on the left-hand side, it's not going to be good because it hurts. Not meaning I'm going to do anything to hurt somebody. I don't mean that. That's not what I meant to say. I mean, it's not good for me. Wind, my hair touching it, anything like that. I have to be really careful when I wash my face, when I wash my hair, putting lotion on my face, anything like that. I have to be really, really careful, because I can trigger a trigeminal neuralgia flare-up of my pain. Even though my face is numb, I still have the pain. So it's just so bizarre to try to explain it unless you feel it and you have it, and hopefully, I pray to God that nobody ever gets this, because it is awful pain to have. I'm sorry, I'm just making sure I'm not talking too long here. I'm trying to stay on track. So what I wanted to talk about, because I've already kind of went into a lot of detail in my other videos, is just kind of how I've been since my 14-week post-op video to present, which would be March 2nd, 2016. So in September of 2015, I really started noticing my pain getting worse and worse and worse, kind of like slowly creeping up worse. And I went to the pain clinic, which will be a completely separate video on that, and didn't work out for me. In a nutshell, they really wanted to just really throw a lot of things like morphine and medical marijuana and medication patches, and that's not what I want. There is no medication, pain medication, narcotic wise, that can help with trigeminal neuralgia pain or anesthesia dolorosa pain, which I'll abbreviate as TN and AD, just so I don't have to try to keep saying those long words, because this is a nerve disease and a nerve disorder. And narcotics, like Vicodin, morphine, things like that, those help with like muscle pain, joint, things like that. So it doesn't help with that. What it does is it kind of like it's almost like an emotional thing, like a psychological. It's like makes you feel like, okay, the edge is taken off a little bit when I take some hydrocodone or oxycodone or something like that, but it doesn't help with the pain. You still have that pain, and I don't want to be caught in that trap of where I'm taking narcotics to help kind of take the edge off of stuff, because I just think for me personally, completely not judging anybody else. Everybody needs to decide for themselves what works best for them. I'm just saying, for me personally, I don't want to be taking narcotic medication just to kind of take the edge off when I still feel the pain 100%. I just don't want to go down that rabbit hole of becoming where I have to take more and more and more and becoming addicted to a pain medication. I just don't want to do that. So that's why for me, I chose not to continue with the pain clinic, but there's more than that, which I'll make in a separate video. And I did go to a chronic pain management class. It was a 10-week class. My family doctor wanted me to go to that. My neurosurgeon is in Portland, which is about an hour and a half, 2 hours away from where I live. So he's been working really closely with my primary doctor, who lives just like 20 minutes from where I live, or excuse me, works from 20 minutes where I live. So I don't have to go to Portland unless it's like absolutely necessary or something like that. So that's why my primary has been kind of handling that. And so I went to that class, and I will discuss that in my pain clinic slash chronic pain class video, which I'll get recorded hopefully this week. And I'm kind of behind, so I apologize for that. Sorry, I'm getting like a little bit of a pain in my face. And so sometimes if I put pressure, it doesn't take it away, but it feels like it's comforting. So give it just a second, guys. Okay. All right. Sorry. It's just really strange how that pain just kind of comes on like that. Clearly, it's not the ones that make me start to cry. I'd have to stop the video. These are just like these little mini zaps that I'm getting in my face, which is brought on by talking. But it's important to me to talk it out and to share this video with you guys too. So anyway, so I ended up going back to see my neurosurgeon. I think it was in November of 2015, after I'd already been kind of seeing my primary doctor, just to make sure, because I did end up with a a sinus infection. So I thought maybe some of the pain and discomfort was from that. And so I saw my primary doctor for that part. But then once that was all done and over with, then I still kept having that pain. So he said, let's have you go see your neurosurgeon just to make sure nothing additional or new is going on with the AD and the TN or anything. So I went back up there, and Dr. Burchell with his fellow of neurosurgeons up there, they saw me, and he told me that he was really perplexed as to why I'm having the facial numbness and the pain. I mean, he expected the facial numbness. Couldn't understand why I was having the pain with the facial numbness, because he was just so perplexed that I had the anesthesia dolorosa in the first place. And he was really hoping that the closer I got to being 1 year post-op brain surgery, that the numbness and that kind of stuff would start to subside. In reality, it was slowly starting to get worse for me. So he spent a really long time with me, my husband, and he said that he is 100% committed to working the problem. He said that he didn't want me to feel like I was just going to get pushed off, like, sorry, I can't help you anymore. There's nothing surgical I can do for you anymore. Try to live your life the best you can. Have a nice day. That is totally not what he's doing with me. And I am extremely thankful for that. And I thank God for that, because I've heard some absolute horror stories from other people on the Neuralgia Facebook group. Sorry, my lips are really super tingling. It's just part of it. So anyway, he said that I've seen in my other online support groups for trigeminal neuralgia, where I hear these horror stories of where these poor people just get pushed off to the side, where they don't find a provider or a neurologist or neurosurgeon or whoever it may be that is willing to invest the time to help them. And I do truly feel really bad for them, because that is unfortunate, because all of us that suffer with us need to have the support that I've been getting. And I know there's lots of others, because I know a lot of the people in my area who see him as well are given that support, and I really wish other people could be given that as well. So he has just said, let's have you come back in a month. He weaned me off the gabapentin that I had been on, because it was doing nothing, which I talk about in my 14-week post-op story or video. So he said, let's take off the gabapentin. He said, and sometimes he goes, the gabapentin can be helping a little bit, but you may not notice it because your pain level is always so high. He said, so you'll notice in a couple days if it seems like your pain is starting to spike, or if it's just going to kind of stay the same and possibly go up slowly. So I went off the gabapentin. It took about a month for me to get off of the high dose that I was on, because you have to be really careful how you go off of it. Plus, I'd been on it for so long. And I didn't notice any increase in my pain as far as like spiking tremendously. I still had the TN attacks, the flare-ups, where it got to where I couldn't talk. I was crying. I'd be curled up in a ball on my bed, just in extreme pain. And which made, as you can imagine, working extremely difficult. I do work outside my home full-time, 40 hours a week, Monday through Friday. And my son is 20. He moved out last year. He's going to college, and my daughter's 16. So luckily my kids aren't small to where I have to do a lot of things to, like, fix their meals, that kind of stuff. My daughter's amazing. So I do have the freedom of laying down as soon as I get home from work, things like that, as I need to. So I am happy about that part. And then he told me that he was going to have me come back in a month once I was off the gabapentin completely, to kind of revisit and see what's going on, how I'm doing. And he was going to reach out to some different facilities to see if there's other kinds of treatments or things like that that could be done to help me, because he almost looked like he didn't look like he was going to cry, like we had tears in his eyes, but you could tell that he was really upset for me, because he just said it's bad enough when he gets elderly people in his office, 60s, 70s, that have this pain. He said, but me being in my early 40s, he said it's just too young. And he goes, this is no way for you to live your life. Every aspect of my life has been altered. And I go into a lot of detail about that on my other videos too. And so, I was in there and I was crying, because you're so emotional because you hurt all the time. You can't get out of the pain. And so I just felt really comforted knowing that he was going to do everything he could to help me with this, and my husband as well, who has been an amazing support person for me. He's actually been my advocate, because it does hurt when I start to talk too much and having to re-explain things. And so he's been wonderful, where he's been able to step in and talk for me. Clearly I couldn't have him do the video for me today, because I really want this to come from me, so you guys know it's 100% genuine and real, and you are getting real honest goodness feedback from one person with trigeminal neuralgia and anesthesia dolorosa, their perspective. So that's why I'm choosing to talk so long. Where am I at? 16 minutes looks like. Okay. So anyway, so I went back to see him a month after I was off of the gabapentin. He said that he had been reaching out to a couple neurosurgeons over in England, and they had some medication. He didn't tell me what it was called. It's not available in the US or Canada at all. He said, but it's something that's over there in England that they use. And they have a couple patients who are pretty similar to me, but they're older than I am, that have the AD and TN, but a couple of them have additional health issues, MS, things like that. So it's not 100% matched to me, because I don't have MS, and I'm not elderly, and I don't have a brain tumor, non-cancerous or anything. So he had been emailing them back and forth. He was sharing my information with them, with my permission, of course. I gave him 100%, like, please, whatever you can do to help me, please, share with other people. That's totally fine. So he said, let's go and have you, he wanted me to go back and try the pain class again if I felt like it was helping me, because it's more of an emotional thing, because there are no medications, and that's what I wanted. I didn't want to be on something to kind of put a band-aid over it. And that's just my own opinion. Again, I don't want to offend anybody who does take pain medication. That's completely personal. It's between you guys and your physician. Please know that I'm not judging anybody. That is not my nature, and I don't mean to say that. I want to be really, really sensitive to that, because I am a really non-judgmental person. I'm actually like a people pleaser, so I just want to make sure you guys know that I don't mean that in any negative way. And I'm sorry if that irritates you. I have a problem with always saying I'm sorry. I can't control it. I mean, I can, but I'm working on that, so it's just part of me. So please be kind if I'm scattering everything. Anyway, so he talked to him, and he said, let's have you come back in a couple weeks. He goes, why don't you guys go ahead and call in? He said, if you don't hear from me before then, that way we don't have to take the travel up there. My husband has the flexibility with his job to work from home if he wants to or needs to, but I hate to have him have to do that unnecessarily. So he ended up calling them actually yesterday, and Dr. Birchall was still out traveling, because he was actually going to England. I didn't mention that, I apologize. So at my last appointment with him, a month after I was off the gabapentin, that's when he said, hey, I've been talking to a couple neurosurgeons over in England. He's actually going to be traveling there in the next month, because he also goes around and he lectures, Dr. Bartel does. So he said, that's why he said to call back in a couple weeks, check in with his fellow neurosurgeon who's also been seeing me, to kind of see if there's been any new information. So my husband called yesterday, and Dr. Birchall and his team actually got back, I think it was last week, and they're in the office this week, but they haven't compiled everything from his trip. They've been seeing patients, that he had. I was actually scheduled for an appointment on the 1st, but we ended up calling, like I just said. Sorry, I'm so scattery. And I didn't have to go in, so that was good. and they said that we should we should have a call or hear from Dr. Birchall by the end of this week, if not the first of next, with the results of his trip to England and all that. And he said if the medication was something he felt that would be a good thing for me to try, then they can, we're going to try to get it in Canada, which is a lot closer for us to go, because I live in Oregon, and the Canadian border is not that far from Oregon, and you go through Washington and that kind of thing. But anyway, he said that way it'd be a possibility for me to get the medication in Canada, or they could get it for me. So that's kind of what we're kind of waiting on to see. So I'm not on any medication at all. I am taking tramadol, which is something I've been taking for probably close to 20 years for my keloids, which is a completely separate topic and video. It's a scarring condition I have, and so I take tramadol off and on. It obviously doesn't take away my pain, but it seems to kind of help when so I can actually kind of sleep a little bit at night and kind of relax me a little bit. And I have a problem with sleeping. When you're in chronic pain, it's hard to sleep. I get flare-ups and stabs, and and the pain from the AD is just awful. It's like having the sensation. I tell you guys, if you could see me, if you could see what I feel externally on my face, I would be sitting here with a hot poker shoved in my ear, somebody standing here with a bunch of needles just poking me in and out and in and out. And I have this sensation right up here, and I don't want to touch my face, but on the left side, but it's like the sensation across my forehead up into about this area. It's this constant tingling, kind of crawling sensation, and it's like a prickly sensation. The best visual I can give people is when you put a pot of water on the stove to boil and you look at it, and those little bubbles are starting to show up in the bottom of the pan, but it's not a full rolling boil yet, but you see the little bubbles kind of coming up. That is what I feel in my face 24/7, and it's just so unnerving. And then I'll get the TN attacks where the pain zaps me so bad that it just instantly drops me to the floor. I have to stop talking. I start crying. It's just awful. And then I still have a lot of tenderness and stuff around where my incision was, which is why I wore my hair up today, by the way. I wanted to show you guys, let me put my phone down, I'll kind of come closer to the camera. I wanted to show you guys how long my hair has grown in 1 year since my surgery. I mean, it's just crazy. So I'll try to get a little bit closer. So this right here is where they shaved my head, and that's where my incision is. So my hair has really grown in really well, I think, for a year. And I will insert some pictures that I put in my 14-week post-op video. I'll also insert those. Oh, sorry, it looks crazy. I'll also insert those at the end of this video so you guys can take a look at how I looked when I was in the hospital, a couple shots when I was after surgery, and then when I was home. So that way you guys can kind of take a look at how my incision and everything looked when my head was still shaved from surgery. So we're just kind of waiting until we hear back from Dr. Birchall's office, and I'm actually on medical leave from work. My primary doctor and my neurosurgeon kind of were talking about me wanting to do this back in September. I was saying no because I am stubborn, and I just didn't want this to steal any more of my life than it already has. But sorry, I guess I get real emotional because it's just really hard. I have been struggling with trying to work all day because I'm normally a really happy, go lucky, positive person. I mean, yeah, I'm real and I have my moments and stuff, everybody does, but overall I try to be really a happy, positive person. And I'm a crafter, which is why my channel name is Scrappy Abby. I've been a crafter for over 20 years. It's a huge part of my life, and everything, sorry, it's the wind blowing outside. Everything in my life has been affected to where I had to take like a year off almost of a crafting hiatus of everything. And some of you who are not crafters might be thinking like, gosh, how could that be so important? But it is such a huge part of me. It's like somebody who's an artist or a musician or something like that, who's passionate about some type of a craft or hobby. And it is something that I thoroughly enjoy. I do make some money on the side for I have a client base where I create things for people and things like that. And so I had to give a lot of that up. I had to give up all kinds of social activities, missing family events, staying home for Thanksgivings, just all kinds of stuff, being home in bed on my birthday, things like that, because my pain is so bad. And it's hard to explain to people who don't know what I have or what's going on, because you're faced, you want to just be like, your face looking like that, but you got to be like this smiling, and I want to be smiling, but it's hard when you hurt all the time. So work's been a real big struggle because it's hard to always have that happy face when you feel like all these things are attacking your face and you have this pain and it's invisible to everybody else. So luckily I'm really surrounded by supportive coworkers and my boss at work and everything. And so, when I need to miss work or go home early or things like that, it's not an issue at all. So my doctor was really encouraging me again, my primary doctor, after I saw him after my first visit with my neurosurgeon when he told me to go off the gabapentin. He wanted my primary to kind of check in with me to make sure everything was going okay since he's closer, and I do have high blood pressure, so he kind of wanted to keep track of that as well. So when I went in to see him, he asked me if I wanted to reconsider talking about going on some type of medical leave. And my husband was really encouraging me. My coworkers were really encouraging me, saying, we don't want you to be gone, but we know that you're really struggling and it's just difficult. So I ended up doing that, and I'm on 6 weeks right now, and I have a couple weeks left. I go back next week to see my doctor. I can be off as long as I want, 6 months, as long as I want to, or I feel like I need to. And I'm actually going to extend it by a couple weeks because I just feel like I'm not really there yet. Plus, I want to see what Dr. Birchall has to offer me as far as like this medication or some type of a solution. So I'm going to be extending it. So luckily, I've been on medical leave to where I have the freedom to go lay down when my face pain is just too much, or I'm so exhausted because I don't sleep because I'm in pain all the time. I have to sleep kind of like, like in a reclined kind of position in bed, kind of like this and on my right. I've been sleeping like that for 2 years because I can't put any pressure on the back of my head on the left because I still have some tenderness and stuff from the surgery. The incision, everything healed fine, but it's just, my head, it's just so, it hurts. And clearly I can't lay on my left side because of my facial pain. And so it's hard to sleep in one position. You don't always get good sleep when you're hurting all the time. So I've just been pretty exhausted. So I'm really grateful to have the capability of being home on disability leave and still, getting my income and everything. So that's been a huge blessing for that. So that's kind of where I'm at right now, you guys. I've been slowly trying to get back into crafting, making some projects. I had my group, my girlfriends that live about 4 hours away from me. We call ourselves the Scrap Gals. They came down and stayed with me for a weekend because I've had to miss going to their area for the last 2 years, ever since this came on, just because of how awful I feel. And when I was on all that medication, there was no way I could have driven myself 4 hours. And, and it's hard to be social and laughing and stuff when you hurt so badly. So they came to me, and it was a huge emotional boost, I can tell you. And so I have some videos on my YouTube channel coming up about that weekend if you guys want to see that. And they were understanding when I needed to go lay down, and when I stopped talking, they didn't like, "Oh, you okay? What's going on?" They totally knew. They went on talking amongst themselves, and which is what I wanted, because I don't want to bring attention to myself about this, because it happens all the time where I stop talking and everybody's like, "Oh my gosh, you okay?" And I totally appreciate the concern from everybody, but I just don't want to I don't want to be that person that always has something wrong with them and calling attention to myself. I want to try to minimize that as much as I can. And the only reason I'm doing videos like I have been about this anyway, because I only share like crafting stuff and happy things about my family, my kids, or whatever in my videos if you watch them. I'm not a vlogger. I don't go around videotaping my life in general. So this is completely out of my comfort zone. I'm usually behind the camera, and you guys just normally see my hands as I'm making projects and stuff, but I feel it's so important to get additional information about awareness out there, because I know when I was first diagnosed, I did nothing but scour the internet for videos and stories and everything else, and I really wanted to contribute to that. So if there's anybody else who is new in their diagnosis, or has had the brain surgery, or is thinking about having the brain surgery, I want to just kind of give my perspective of it so they could have another real person's perception and how they're going through this journey. And I still am going through it. I'll have this for life until there is a cure. And October 7th is National Trigeminal Neuralgia Awareness Day. So I'll be having some projects and things lined up for that. My husband is working with me, as well as some people in my community, to try to do something to help bring awareness, for this. And so that'll be coming up in October, but I just wanted to throw that out there. So that's the reason I'm doing this. I'm actually pretty uncomfortable having the camera on my face, especially when I don't feel well, because I'm a girl, everybody wants to look pretty and stuff, but I just, you know, it's just, this is how it is. I'm just trying to be real and be honest with you guys, and I feel pretty vulnerable, so please don't critique me or leave bad comments if it looks like I'm scattery or this isn't, you know, like scripted or anything, because I don't want it to look like that. So I'm starting to get a little teary, it's emotional. But it's important to me to talk about it because I want to help other people that are hurting and in the same position as me, because I know it was a huge help for me. And there's one lady in particular, and I've already called her out before in another video, and her YouTube channel name is BC Doula, and her name is Monica, and I'll leave a link to her first video that I found. She was a huge support to me when she didn't even know who I was, and she still doesn't know me. We talked and stuff back and forth, you know, on video, on each of our videos and that kind of stuff. And she's a crafter as well. She's African American, which has nothing to do with having TN, but it's just kind of cool because there aren't that many where I live. I mean, I think the most is because of me and my 2 kids. So it's just kind of nice to have, you know, I don't know. And she crafts, like I said, and she went to the brain surgery and everything like I went through, but she went through it obviously a year before I did. So I just found her as a huge comfort to me. So I want to leave a link to her channel so you guys can watch her videos if anybody has trigeminal neuralgia or AD, or has a family member who has it. You just want to kind of get more information to help you better support that person. That way, and she's one of many out there, but that's the one that resonated the most with me. And there's another gal I found not that long ago. Kimberly is her name, and I don't remember the name of her channel, but I'll link hers as well. She also has TN. I don't think she's ever had surgery. I don't think she's a candidate for surgery. I don't think, because she's never talked about it, but I'll link her channel below as well so you guys can find hers. And she does updates quite often solely about her neuralgia, and she also has a video of some little tips and tricks that she uses to kind of help with some of her pain. So that might be helpful to you guys as well. So before I stop, let's see, I'm at 31 minutes almost. So you guys, I'm talking so long. I'm starting to feel like I'm stuttering, because one, because I'm emotional, and 2, because I've been talking so long. So let me just kind of wrap this up really quickly. I wanted to share a couple things with you first. I mentioned this in my first couple videos, and I didn't have the book downstairs with me at the time, but this is what a lot of TNers and a lot of people who have trigeminal neuralgia, family members, they get this book called Striking Back, and they say that this is like the Bible for anybody who has trigeminal neuralgia. So you can pause the video if you want to write down this information, but I just bought mine from Amazon, so I'll try to remember to put a link to where you can buy this. And this is a phenomenal book, an amazing book, and I was shocked to find that Dr. Burchell has a lot of content in this book, and that's the neurosurgeon I saw. I had no clue he was in this book. I had already had an appointment scheduled with him, but I had no clue he was in this book until I got this, and I was reading. I was like, oh my gosh, you know. So I was really fortunate to get in with a neurosurgeon who's on top of his game. But there's just amazing information in here. I've already read this a couple times. I'm going to reread it again. I haven't read through it book front to cover since I had surgery, but I'm going to, because I'm going to interpret it differently now because I'm in a different stage or phase of having trigeminal neuralgia. So this is an amazing book for anybody to get, and my husband looked through this as well with me, so I would encourage anybody to get this book. There's also, I thought I heard or read in one of the online support groups that there was a newer or revised version of this. I haven't seen that. I don't know if it's true or not, but I was going to look into it. But you know, this is a good book to get. It'll give you some tips. There's even a chapter, I think, on the support person in your life, on, you know, ways to kind of help support that person, because I know my husband feels helpless a lot of the times because there's nothing he can do to help alleviate the pain. You know, it's not like, you know, getting a heating pad or taking, you know, Advil or doing something is going to help. The best thing that helps me when my pain is spiked high is I'm left alone and I don't talk and I'm in a quiet place, and he gets that. So if we're having dinner, I'm at a family event or something, if I get up and I walk away and I go sit in the car or I walk into another room, all my family and my close circle of friends, they all know that I'm fine. I just needed to step away and kind of have a minute. And so that's been helpful. And my coworkers have as well support me with that. Another thing I wanted to share with you guys, I don't think I've shown this on my YouTube channel, but I've put lots of pictures on my Instagram and on my Facebook, which I'll link below if you guys are interested in following me on Instagram. I post all kinds of things on those social media sites, my family, about my kids, my husband, my little dog Bella. She's so cute. She's laying down there sleeping. Obviously crafting stuff, my love of purple, which I don't have on right now, but obviously I love purple. I'm a purple girl. So I have all kinds of really cool eclectic stuff, but I also post a lot of things about trigeminal neuralgia and awareness on there too. So this is the Webster's pages, in case anybody's crafty or a planner and they want to know. This is one of the Webster's pages, Color Crush planners, and of course it's purple because that's my color. I have turned this into my pain planner. I have quite a few planners. I'm a very organized kind of a person. I'm a list maker, but I've kind of, just to show you the front of this as I'm talking, I turned this into my kind of journal slash diary slash log for nothing but TN, meaning how I'm feeling. Then when I was on the medication, I kept a log of how much I took and when I tapered off my medication, I kept a log so I could, I'm not going to show you because it's got some personal, thoughts and stuff, but I just wanted to show you this one thing that I found. Or some things I put in here to kind of help with my spirit, I guess. So anyway, so I kept track of when I was tapering off the medication. I would write notes about how I was feeling. So I put a page in here, like this isn't one of the filled in pages, but just to give you an example, like instead of using it for like, planner stuff, like dates and things like that, I would just kind of write in here. I would fix them. I would kind of cutify them up like a little mini scrapbook journal thing. And I would write, how I was feeling, whether it's one word descriptions or whether it was a whole 2 pages of me writing out frustrations, or how I was feeling that day, or how blessed I am with my husband who's so supportive, my friends and my family, my coworkers, all those kinds of things. So I wanted to share this with you guys because anybody who has this or any type of chronic pain doesn't have to be strictly specific to what I have. For me, having this to write down how I'm feeling, my thoughts, and writing down my appointments and what medication I was on and when I need to take it and when I tapered off of it and that kind of stuff, it just made it a really nice, easy, compact way to keep track of that kind of stuff. And it's a comfort for me to be able to write in here and refer to this. Plus, it's been great having this to take to my appointments. So when I had my questions, if I forgot to tell my husband, or if I wrote it down on a post-it note, but then left the post-it note in my room and we're on our way to Portland, that doesn't do me any good. So that's another good tip I guess I can offer, is to write down, whether you want to pack something like this, whether it's as simple as just a piece of paper, or you do some kind of an app in your phone, which is what I started to do, but I really like to have the pen to paper for me. Whatever format works best for you, I would encourage you guys to record how you're feeling, what medications you're taking, if you taper off of one and you add another one in the mix, your appointments, things like that. Because the way that the neurosurgeons and the neurologists and stuff diagnose this, or help, or get you the right diagnosis and know the right path to treat you. Yeah, sorry, my face is starting to freeze up. It's like getting tight. It's hard for me to talk. The way that they treat you the best, or know the right way to attempt to treat you, is by patient description of your symptoms. And so a lot of times, you get forgetful and you forget to write something down. And so I think it's important to just document it for that purpose. So I'm sorry if this was really scattery. I was going to have like a little note card, so I kind of tried to stay on point a little bit, but I didn't want this to look scripted or anything, and clearly it doesn't because it's very choppy, but that's kind of how I am right now in my life, and I wanted to be real. So if anybody watching this has trigeminal neuralgia, anesthesia dolorosa, or any other types of neuralgias, there's occipital, some people have atypical, which is both sides of the face, any type of neuralgia, and you stumbled across my video, if you guys have any questions or anything, please leave me a comment, or you can send me a private message if you're not comfortable with that. My email is scrapandabby@gmail.com. I'll try to remember to put it in the video as I'm editing this, if not in the description. I'm more than happy to talk to anybody. I mean, I'm clearly not an expert in this at all. I mean, I've only been diagnosed for a little under 3 years, about 2.5 years. I suffered for this for months before I got diagnosed. I was getting treated for an ear infection I didn't have, so I had this for a long time before I got the official diagnosis. But I know there's lots of people who've had this for decades, and I just can't even imagine that at all. But I can give experience for my own self, my own personal experience, or be a support person if I can, because I know it's important to have those people to reach out to, because you don't ever have to explain to another TN, or you don't have to apologize or say I'm sorry for this. You can rant and you can You know, if some people want to swear, that makes them feel better. Some people want to cry or whatever. There's no judgment, because we all have it and we get it and we know how you're feeling. So I want to be a support to somebody if they need that. I would also encourage you to go to the many different facial support groups on Facebook if you're on Facebook. If you're not on social media, the facial pain I'll put the website in because I'm going to tell it to you wrong. But there are quite a few reputable facial pain support groups, online support groups, and you can be anonymous if you want to, that you can reach out and get some help. And so I think it's important for people to have outlets other than their family or their friends or their doctor to reach out. And I think it's critical to have people who have it kind of communicate with you and kind of work through that problem. So that's what I was trying to say. And if you want to become a subscriber of my channel and you're not already, I will, see, I'm starting to talk weird. I will be doing additional updates post my 1-year brain surgery about trigeminal neuralgia, and I'll put it in the playlist strictly for this. So if you come back to my channel and you're not interested at all in anything crafty, you can go right to that playlist and not have to sift through hundreds of crafting videos. But if you do like crafting and you like purple stuff, then you know I'm your girl, because I do all that too. So, but thank you to everybody for watching this super long video. Oh my gosh, it's 40 minutes. Oh, it's hard to get everything in a tiny thing. Of how I'm doing everything, it's a lot. So thank you guys for sticking with me for this whole long time. Again, if you have any questions, for anybody who is here because of my crafty stuff and you happen to watch this, thank you for sticking through this with me. And this will explain maybe why sometimes I'm stuttery and that kind of stuff in my crafting videos, or why there was such a big gap for my crafting stuff. Now you guys know why. I'm trying to get back into it and trying to get back into my life as normal as I can. It's hard, and I'm just trying to learn how to live my life with this pain. So please, I will be doing my, probably not today because my face is hurting too bad to talk a long time again. Sorry, I'm sniffing. But I will be doing a video about my experience and story with the pain clinic that I went to, and I will also include the chronic pain support class in that video. I'll lump it together, and I'll kind of do some pictures and screenshots of the information they passed out in the class in case anybody is interested, because some of this material you can find online, and there were a couple of videos they showed in class that were on YouTube. So I wrote those down in my book that I took to class, so I will link those in that video too, so you guys can watch that if you're interested in doing that. So thanks you guys. I'm going to stop talking. Please be kind in my video. I try to be not professional, but I try to be, you know, I've seen a lot of people who are very eloquent and they put their videos together very smoothly, and you know, I'm just trying to be real, I guess. So thank you to you guys, and hopefully my remote battery hasn't died so I can turn this off. But see you guys next time. Stay tuned for some more scrappy videos, and help me celebrate my 1-year anniversary of surviving brain surgery. Woohoo! So hang in there, everybody, all my TN family and stuff. And Monica, if you're watching this, hello to you. Hi. Big fan here. And I'll see you guys next time. Happy scrapping, happy crafting. All my TN people, hang in there. We're in this together. I love you guys. And